Welcome, everybody. Thanks for joining us for the NLN Tech Blog video podcast. I'm Dr. Sue Forneris. I direct the NLN Center for Innovation and Simulation and Technology here at the National League for Nursing in Washington, D.C. And I'm here today having a conversation with one of our wonderful sim leaders, Amy Cowperthwait, who is a simulation leader alumni from 2015. She's also an adult health clinical nurse specialist, and she's a nursing faculty and co-director of the healthcare theater program at the University of Delaware. And she's also CEO of Avkin. And we're going to learn a little bit more about Amy and her background. And Amy, thanks for taking time today to be with us and to share with us a little bit about your exciting work, and both as an educator and as an entrepreneur.
Thank you. I'm so honored to be asked, and happy to share about what we've been doing. And it's a large part of this is a result of what the National League for Nursing Simulation Leadership Group did for me as well. So
yeah, we're thrilled. So I thought maybe what we could start out with is maybe talk a little bit about some of the significant milestones in your career, and maybe roll that into how you moved toward your entrepreneurial spirit.
Sure. I'll give you the quick, just so everybody kind of gets a baseline. In 2006, I left a 25-year career in the emergency department as a nurse, a charge and staff nurse. And when I joined the University of Delaware, when I got hired at the University of Delaware, I was really kind of charged to start doing simulation there. It was really kind of the early stages of simulation. They had just gotten 2 high-fidelity mannequins and said, figure these things out and get them integrated into the curriculum for us. So I really kind of spent some time figuring out how to program the mannequins. I certainly came from emergency department nursing, had no computer, skills whatsoever, other than kind of Microsoft Word or whatever. But I really began to kind of dive deep into it. And the more I started to do simulation education with the mannequins, the more I struggled with the fact that we were only teaching part of what the students needed to learn. We weren't really addressing the affective domain, and we were really, there was a lot of excuses in the debriefing processes of, well, if it was a real person, I would have said that or done that. And so I really started to think of solutions. Nurses are by nature problem solvers, and it's a great entrepreneurial trait to have, is to be a problem solver. So I started to look around me. I didn't have resources. I didn't have a large budget. I actually didn't have any budget that was just earmarked for the sim lab. But what I did have at the university was resources, other people, student resources that were really excited to be able to help and join in. And by finding champions within the university for interprofessional education, as well as a champion in the theater department, I was able to create a program called Healthcare Theater, which you mentioned in the intro. And that program, it started in 2009. And it really, what it does is we teach a university 4-credit course, not FOUR, but FOR. So it's a 3-credit course that is cross-credited between theater and nursing, and the students get 3 credits that are enrolled, and they are our patients and our family members for the healthcare simulations that we do, whether it's IPE simulations or nursing specific, or it could also be physical therapy or grad nursing. But the program has grown so much and gotten so much traction since 2009 that we actually are doing outside contracts that actually create revenue to support the program.
So it was really kind of, what I'm hearing you say is that you were really kind of laying the groundwork for developing a way to train individuals to function as simulated patients or simulated participants to enhance the fidelity for the students.
Yes.
Oh, excellent.
Yeah, and so the thing is that because it's a 4-credit class, it's within the bounds of the university, their GPA is a strong motivator for them to get the standardization right so that they're, the same level of difficulty as the other students. And I really kind of tour around the country now and talk about starting a healthcare theater program at other universities. There seems to be such a huge interest in starting something of, an affordable SP program. We've had adult learners that come back and want to be simulated participants for us in the course. But because we already have this course, we have the structure, we have the curriculum, and we can bring returning adult learners in. So now we even have some age variation. It used to be a lot of, 20-something maladies that would be having them in acute care. But now we have kind of that really strong cross-section. So that was really a huge benefit. But what ended up happening was the person that was hired to take over for me for the mannequin simulations, as I was doing diversity simulations and psych simulations with these simulated participants, she left in the middle of spring semester and basically wasn't returning for various reasons. So I was the only one that knew how to use those mannequins. So I got put back down in with the mannequins, and we were doing a tracheostomy simulation. And all of a sudden, again, I had to remember the computer programs and, pressing the buttons and filling out the evaluation form and, making sure that the learners were doing everything. And I started to think it was so much easier when I had live people, because they could, do the nonverbal behaviors and the communication and really help even with the feedback process in debriefing. So I began to think of how I could strap something to these students that were coming in from classes to create a tracheostomy that would be realistic and authentic. And then that idea sprung into working with the engineering department at the university. So that all of this began with kind of an idea sitting in the back of a control room saying this tracheostomy simulation is not working because the patient's nonverbal and there wasn't very much nonverbal reactions.
So kind of in between a mannequin, which doesn't really give you that, feedback in terms of suctioning, versus you really can't suction a simulated participant for real either. So trying to kind of a hybrid approach then to see what you can do to make it more believable and real for the learner.
Right. So the sims that we were doing with the healthcare theater students previous were diversity sims, psych sims. Maybe they were family members of our pediatric mannequin. Nothing that required any invasive procedures, but obviously there's limitations typically with simulated participants.
Right.
You can't put catheters in their bladder during the middle of a simulation. You can't stick them repeatedly with needles. And I knew I probably would get fired if I asked if I could cut holes in their neck. So I decided
not happening.
Some type of a wearable technology would be a better option.
Yeah.
As I'm a sim educator, I was able to take all the things that were limitations with the mannequins and really actually infuse that into this wearable technology. Still, at this point, having no intention whatsoever of ever starting a company, I can remember saying, I don't want to be a CEO. I don't want to go on Shark Tank, those kinds of things, because to me, that was scary as a nurse. I was,
Sure.
It was uncharted territory.
Well, we put ourselves sometimes into these paradigms that, we can't, when actually we probably could, because you have grown this now to a company.
Yeah. Well, so what happened was in 2015, I had applied for the NLN Sim Leadership Program. And at that point, and I think that this is a really important point for people that are listening, sim educators, if you are kind of the only one or there's just a couple within your university, you have no one to compare yourself to at your setting. And so once we got together in the sim leadership group, all of a sudden I was with 20 or 19 other like-minded individuals that, were at different universities, but we were all working towards the same goal. And all of a sudden people were really excited about the healthcare theater program. They were really excited about what was being done there. And of course I was excited about the things they were doing, but we were now comparing apples to apples instead of apples to oranges. And it created this camaraderie that even today, we are still each other's biggest cheerleaders and support. But where I felt weak, they were strong for me and they encouraged me to continue to push forward. So we really, again, I didn't have an intention of starting the company, but one of the biggest takeaways from that leadership group was, number one, the National League for Nurses selected me as a sim leader. So that was already, very, very honoring to me and provided some value or credentials or whatever you want to say. But then to get amongst these other colleagues, it really just formulated and fueled the fire of what this cohort could actually do. And if you look at the 2015 cohort, we are extremely prolific.
We are.
Still working together, still creating programs, doing consulting, all kinds of things. And I think it's because we know that if one of us trips, there's 19 others of us to catch that person and to help them. So it takes away some of the fear of failure. You're willing to take more risk because you know that there's 19 other rock stars behind you that are going to support you through that. And it's not just the cohort, it's also the mentorship that we've gotten from the National League for Nurses, as well as we won a business pitch competition in 2015, and that provided some initial funding to get things started, and also some business mentorship, because I had never started a business. I didn't know anything about it. And that was really, it was huge. It was huge to have that mentorship and that support to really get us going.
So now you have this company where you're creating hybrid equipment for use in catheterization and thoracic tracheostomies where we have to suction. So you mentioned that you never wanted to be on Shark Tank. So talk about, because that kind of came back to haunt you.
It did. It's really funny how sometimes that kind of stuff happens, but
Sure.
I had never, that was one of the first things out of my mouth was, you can't make me go on Shark Tank. I'm not going to do it, because I felt inadequate. I felt inadequate to stand before those sharks. But I recently got a call, it was at the end of August, but the taping was in the beginning of September, I had been selected to be one of the two nurse entrepreneurs to present to Daymond John on the Dr. Oz show. So Daymond was on talking about thyroid cancer and, awareness and prevention and things along those lines. But part of the segment was to really kind of have two nurse entrepreneurs pitch to Daymond, and I was selected to be one of the two. And I didn't hesitate. At that point, I felt very confident. They did say it was going to be a kinder, gentler pitch, which it was. But even if it wasn't, I wouldn't have been afraid, because I had been given so many, so I learned so much, and I had been given so many skills that I felt as though I could definitely stand my own in the midst of that Shark Tank if I needed to.
Yeah, well, we have a clip for our viewers of that experience that they can link to and see what happened. But when I watched it, Amy, I was very impressed with how you were able to convey the message about the importance of it related to nursing education. And totally enjoyed the reaction from Daymond, because he did not have anything. He was like, I'm so glad there are people like you out there.
Yeah.
How was that experience? Because it ended up with a special award also. So talk about that, because that's pretty cool.
Yeah, well, we were competing they called it the Golden Stethoscope Award. And I mean, honestly, just the opportunity to have the platform to get in front of Dr. Oz and Daymond, and I didn't get much feedback from Daymond, as you said, but I did have the opportunity to kind of see and hear the reactions that they had to the products. But this Golden Stethoscope Award was, basically, it was actually given an honor to both of us, because Daymond couldn't pick. But the idea is that these are very promising pieces of technology or pieces of equipment or products, and that us as nurse entrepreneurs were definitely, kind of trend setting with what we were doing.
Yeah, it's just so impressive, and congratulations. I mean, just to know you and then to watch you up there, it was just really an honor for us as the NLN to see one of our rising stars. So that was just excellent. So now I want to talk a little bit about this wonderful entrepreneurial spirit you have, and all of the wonderful programming and education components that are coming out of this work that you started. Talk to me a little bit about where you see some of the trends or gaps in SIM nursing education, and you share a little bit about your thinking relative to that.
Sure. Well, I think the biggest thing from my perspective, again, just knowing the world that I live in, and what I firmly and passionately believe in, is having a live person in that bed for simulation as much as possible. It doesn't always work. You can't find a 3-year-old that's going to be playing the part of a simulated participant. But having a family member or 2 family members, or maybe a same-sex couple or something like that, to just have them to learn to interact, it really, again, assists that piece of it. But knowing that about me, so I bring you the knowledge of this, is that what I see, and as I present this all over the country, I'm getting validation that our students are less and less comfortable with face-to-face communication. They are less and less comfortable with dealing with patients that are suffering and in pain. It's not that they don't want to. They've entered healthcare to help people. They want to help people. They believe in it. The millennial generation, that's kind of, they want to be a part of the difference, but they don't have the skills or the techniques.
Isn't that interesting? Yeah.
It is. And it's
digital age has removed some of that face-to-face learning and taking from cues and things like that you don't pick up on as much with digital.
Yeah, and it's significant. It's significant. I mean, if you look at the data, they are literally paying to take a course in how to have a conversation. I mean, I think we all come at everything from our own mental map, and typically nurses are very comfortable conversing and, talking with people from all walks of life. this generation entering, it's a skill set that they don't have automatically. And so we really have to not just work on the cognitive, not just work on the psychomotor, but we've got to work on this affective piece as well. Because if we're not giving them those tools, what we're seeing is the nurses are going out, they're getting burnt out, they're getting compassion burnout, and they're going and choosing another profession. If we give them the tools, if we help them with the communication piece, they're going to stay in the profession.
Sure.
They're going to stick with it. So the place to do that is in their undergrad or in their nurse residency program, in my opinion. But we've got to work on that. So from the perspective of an individual, having them work with simulated participants, not just in simulation, but also feedback from the simulated participants in how to improve their communication skills, you see huge growth in a very short period of time.
Yeah, absolutely.
And they're so appreciative of the fact that we're addressing the communication skills with them. Yeah. Just a little anecdotal thing. I have accelerated nursing students and I have traditional. My traditional students get 4 different diversity sims. My accelerated don't, because the coursework fits in over a winter session that they don't have it. When they mainstream, when they do field experiences, my traditional students are much more comfortable going in the room and conversing with patients than my accelerated
students. Isn't that interesting?
That comes from clinical coordinators at the site saying, why is it that the younger students are so much more comfortable walking in the room than, and I think it has to do with I can't point to it specifically, but that's the only difference that I know of in the curriculum for them.
Yeah. So and you're raising a really good point in terms of the value that brings to the profession as they launch their profession. And, that's perhaps one of the things that as we think about this generation of professionals moving into care for, the populations, that would be something that organizations would want to pay attention to and how simulation can really help. What are your thoughts about that value of sim in relationship to building skills for professionals moving into the future of nursing?
I think it's huge. I think that there are so many possibilities with simulation, and that's the beauty in simulation. It can be modified, it can be adapted, and it can be targeted for specific issues within, whether it's something that's the clinical instructors are seeing. So as an example, I had one clinical instructor that was struggling with teaching didactically and then them seeing in clinical the difference between acute and chronic renal failure. Simulation's perfect for that. It's the perfect environment to draw those out so that they're able to tie back to something. So they're learning it, they're didactic, but then it was a while till they would maybe see it in clinical. But once we do that sim and we create the dichotomy there, they're able to see it, and then their test scores went through the roof and they were just so much more comfortable. So,
well, it was creating context for them.
It does.
It's that it's putting the thinking and the doing together. That's hard. That's a separate step. And I hear what you're saying. Simulation does provide an opportunity to make sure that every student has the opportunity to engage in a specific learning encounter that you wouldn't necessarily be able to guarantee they would get in a live clinical.
Right. And I think the whole idea of trending in simulation, I think the other big piece of this is I'm seeing a huge trend in people wanting to start simulated participant programs, even since we started the company in 2016. It kind of started off a little slow, and now it's skyrocketing where people are contacting us to come and do presentations and webinars, making appointments with me to, talk about it. And, I have my simulation educators from the University of Delaware very busy with that, because we want to help people as much as we possibly can to start programs like this, firmly believing in it. I think the other big trend that I'm seeing is like the immersive rooms and the augmented reality and things along those lines, definitely, coming out more at conferences and, presentations in the literature and things along those lines.
Using the technology in a smart way to create that contextual learning environment.
Yeah.
So what advice do you have for nurse educators, in the context of today's healthcare system, as we think about learning environments moving forward? What kind of thoughts and ideas do you have about that?
So I think there's just a few. One of them is seek professional development outside of nursing. So as nurses, we know we have to constantly be learning and we have to constantly be growing. But the concept of the fact that you are now a leader, whether someone's told you that you're in leadership or not, if you are a sim educator, you are a leader. And you need to be growing yourself as a leader. There's so many good books out there on leadership, and they really, really helped me. When I was getting ready to start the business, I listened to over 250 books on Audible as I was walking, my daily walks on how to start a business, how to be a leader, women in leadership, entrepreneurship. There's so many ripe opportunities. I can't point you to a specific book that I heard such and such in, but it's in me because I know where I was walking at the time. But really seeking professional development outside of just the nursing professional development. And then the other one that I think that I wish that I could go back and tell myself years ago is to really be aware that we as nurses and as women, mostly women dominated, we're taught to use suggestive language. And that suggestive language gets you nowhere when you are trying to talk to your dean about getting an additional piece of equipment or to grow the program or to get additional staffing. I can remember when I started healthcare theater, I would sit down with my dean who loved me. She loved the program, was excited. And I'd say, having an administrator would really be helpful. I think, and I said that 3 years in a row. And I finally said, the healthcare theater program is going to cease to exist unless we have an administrator. And all of a sudden, that's when I was able to get, an administrator. So the suggestive language does not work when you're talking to your dean or your director or whoever is in leadership, because they have lots of other people that are voices around them. So you have to take out that suggestive language, and you have to be very clear about what your needs are, what the outcomes are going to be if you're able to get those resources, and what are the consequences if you don't get those resources, because then they hear what you're saying. But the suggestive language is just blabber to them. So just be aware of that and think that through.
That is an really important point. It's to the point, what do you want versus hinting at it.
Yes, yeah, exactly. And then I would also say that I think looking for colleagues, there's a book called The Stiletto Network that I read, and it was the NLN sisters are my Stiletto Network, but looking for a group, whether it's within a regional simulation consortium or it is part of one of the NAXL or NLN leadership groups, is to plug yourself into someplace, because what happens when you're not comparing apples to apples is you never feel as though you're getting anywhere or making any progress. And when you start to rub shoulders with people that are in the same boat as you are, you learn from them, you teach them, and all of a sudden it's this great repository of mentorship, mutually beneficial, right? But it's a peer assisted learning piece, right? So it's all about that concept of not just being stuck in your own bubble, because we all do that when the simulation semester happens, we get swallowed by it, but come back up for air and find people around you that you can meet with and talk about, and find really, unique and interesting ways to grow your program.
Yeah, well, those are wonderful, wonderful thoughts.
Thanks.
I appreciate your taking the time to share with us your expertise and the wonderful accomplishments, and we look forward to more good things to come, Amy.
Great, thanks so much.
Avkin. Yeah, so there's a link directly to Amy's experience on the Dr. Oz show, and you continue to be a rising star. So thank you again. All right. Nice talking with you.